I was really surprised about his test results. I really didn't think they'd indicate that he had hepatitis.
I know. I was surprised, too. We're going to have to take extra precautions when he comes in now.
What patient are you guys talking about?
We're talking about Mr. Jones. He's been in our clinic every week for the last 3 or 4 weeks.
What you see here is a severe breach of patient confidentiality. When staff members discuss personal patient information where other people can overhear, patients lose trust in our healthcare system, and the system can be liable.
We have a binding pact with our patients to maintain the confidentiality of their health information. This is vital to our commitment of delivering the highest quality of patient care. The new federal law called Hipaa reinforces that responsibility. Our healthcare environment is changing daily. New information technology provides us with an amazing list of new methods to diagnose illnesses earlier, identify potential medication errors before they occur, and communicate instantaneously with other healthcare providers from around the world. However, with those new technologies comes an increasingly difficult challenge to keep our patients' health information private and secure. Please pay close attention to this video. It will provide guidelines on how we should protect patient information in our daily work. We provide our patients, our community, and the region we serve with extraordinary care. Let's all make a pledge to live up to our promise and keep our patients' health information confidential.
While patient confidentiality has always been important in healthcare, Hipaa now provides patients with federal privacy protection. First off, do you know what Hipaa stands for? Not hardly. It means Health Insurance Portability and Accountability Act. Hipaa consists of 3 major parts. Billing, which requires standardized formatting. Privacy, which protects patients' health information and how we use it. And security, which outlines safeguards you must follow with your computer and campus networks. This video will focus on how the privacy and security regulations affect you. Key to the privacy regulation is knowing how protected health information, or PHI, may be used. Protected health information is individually identifiable health information, such as a patient's medical record.
We use protected health information daily for patient care, billing, research, and teaching. We need it to perform our daily work, but we must always safeguard this information to keep the patient's trust.
If patients do not believe their personal health information will remain confidential, they may be reluctant to access our healthcare facilities. Worse, they may be hesitant to share important details with us that are vital to diagnosis and appropriate care.
So, do you have any other questions for me today?
No.
Okay, well, it's great seeing you. I'm just going to have you go out to the front desk and make an appointment, and we'll see you at your next appointment.
Okay, thanks.
Great, bye.
I thought you were going to tell her that you were depressed. Why didn't you?
Well, I was going to, but I saw Elena at the front desk. You know, she lives in my neighborhood, and I was just worried that she was going to go tell everyone about my problems.
Here are ways we can safeguard PHI and maintain patient trust.
This psychiatry rotation has been very interesting. Do you remember our new patient, Tammy?
Yeah, I do.
Well, she's the branch manager of my bank. She has always appeared to be a stable individual. I was shocked to find out that she has bipolar disorder and auditory hallucinations. She honestly thinks God is telling her to be the CEO of the bank. Can you explain this to me?
Well, I think those are interesting observations, but why don't we talk about it upstairs? There are other people here that aren't team members.
Okay.
Do not discuss confidential patient information with others who are not involved in that patient's care. Pull curtains, lower your voice, or close the door in patients' rooms.
Hi, Marilyn. How are you today?
Oh, hi, Holly. I'm doing good. How about you?
I'm doing good. Hey, guess who I just saw on the oncology floor?
Who?
The mayor.
You're kidding.
I wonder what he's doing here.
I don't know. Let's go in and look.
Okay.
Do not access patient information unless you have a need to know to perform your assigned duties. Also, you may not look up information on friends, relatives, or others, even if you have their permission. Accessing confidential information without a need to know can result in corrective action up to and including termination.
Hi, you look busy.
Hi, Dr. Lewis. What brings you here today?
I need to review some records on women between the ages of 30 and 50 with diabetes.
Okay, and what do you intend to do with this information?
I'm thinking about doing a research project on it.
Okay, so what I'll need you to do is fill out our standard research preparation form, if you'll just come with me.
Sure.
HIPAA also applies to research. Generally, a researcher must obtain the patient's authorization to use his or her PHI for research. However, a patient's PHI may be used solely to prepare research proposals if the researcher signs a research preparation form.
Got a medium hamburger mushroom pizza, bill 1106, 20. $9.94 is your change. Thank you.
Be sure to verify all fax numbers before sending confidential patient information.
Hi, we have an appointment with Dr. Walburn.
Hi, and what's her name?
Claire Smith.
Do you have your insurance information?
Yeah.
Okay. There you go. It might be just a couple minutes. Would she like some crayons and paper to draw with?
Sure. Do you want a color?
Yeah. There you go.
Thank you.
Thank you.
Okay, let's go.
Confidential information that is no longer needed should be shredded or properly disposed immediately in a recycling bin. Here are other tips on how you can keep patient information confidential. Place patient charts face down in clinic room doors so passers-by can't read the name. Face computer screens away from where the public can see them and log off when leaving your computer. You can compromise the integrity of the network where patient information is stored by inadvertently introducing a computer virus. Only open email attachments that have been run through an antivirus program. Keep your password confidential. Do not use a password that can be easily guessed. Do not write your password down where others can find it, and do not share your password. Open email attachments only from trusted sources. Report suspicious activity to campus security and any out-of-the-ordinary computer activity to the Information Technology Help Desk. ITS will then review the current technical safeguards to determine if changes need to be made. HIPAA also provides patients with several rights. They will receive a Notice of Privacy Practices that describes how we may use and disclose their protected health information and their rights. These rights include the right to review their record and request to amend the information it contains, request restrictions on how their health information is used, request private communications. For example, requests to be contacted at a certain phone number or a special mailing address. File a complaint with the Patient Relations Department or with the Secretary of Health and Human Services. An accounting of disclosures beyond treatment, payment, and healthcare operations. While these disclosures are required or permitted by law, we must now keep a record of them. Examples include, but are not limited to, reports to the Food and Drug Administration, infectious disease reporting to the state, and record review for research. It is your responsibility to be familiar with these HIPAA policies and procedures. Remember, the government can impose penalties, including fines and imprisonment under HIPAA. If you have any questions, speak with your supervisor, contact the HIPAA Privacy or Information Security Officer, or visit our website. Additional information is available from the HIPAA selection on the intranet pages.
HIPAA is far-reaching and affects many areas of our daily work, whether it be in patient care, research, education, or outreach. We all must become familiar with the many policies and procedures that govern the protection of patient information. The best advice I can give you is to live by the golden rule of confidentiality. Treat a patient's information the way you would want your own information treated. I believe protecting patient information is everyone's responsibility, and it's part of our culture of excellence here.